Today, we'll talk about what happens in your body after a meal and what a short, practical 2-week nutrition experiment can and cannot do. Important, this is general education. If you use insulin or other diabetes medicines, if you take warfarin, or if you have kidney disease, heart failure, or bowel disease, talk to your clinician before making sudden diet changes. After a high-fat meal, many people experience postprandial lipemia, a temporary rise in fat-carrying particles and triglycerides in the blood. This is real physiology, not a metaphor, but it does not mean your blood becomes sludge, and it does not prove your immune system is paralyzed. What the science does show is more specific. Large, high-fat meals can increase post-meal triglycerides and inflammatory signals, and in some studies are linked with a measurable rise in circulating endotoxin markers, especially in people with obesity or metabolic disease. Now let's discuss one of the most interesting feeding experiments in nutrition science. Researchers led by Stephen O'Keefe performed a supervised 2-week diet exchange between African Americans in the United States and rural Africans in South Africa. The Americans received a high-fiber, low-fat African-style diet. The rural Africans received a higher-fat, lower-fiber Western-style diet. In just 2 weeks, the study observed reciprocal changes in colon biology, especially biomarkers related to cancer risk, including Ki-67 and inflammatory immune cell markers in colon biopsies. Here is the key point: calibrated correctly. The study did not prove that anyone turned off cancer in 14 days. What it did show is that short-term diet changes can quickly shift the colon's microbial metabolism and measurable tissue markers. In the paper, Ki-67 proliferation was higher at baseline in the American group and decreased after the high-fiber, low-fat diet, while the opposite happened in the rural Africans after Westernization. Secondary bile acids fell sharply in the Americans on the higher fiber diet, and butyrate-related fermentation increased. These are meaningful biological signals, but they are still surrogate markers, not long-term clinical outcomes. So what is a reasonable, evidence-aligned message for older adults? First, dietary patterns that emphasize vegetables, fruits, legumes, and whole grains, and that limit processed meat, align with major cancer prevention recommendations. Second, expecting to clean arteries in 2 weeks is not realistic. Coronary plaque regression, when it is documented, has been reported over longer time frames, such as around a year in intensive lifestyle trials. Third, 2 weeks can still be useful. Many people can improve post-meal triglycerides, bowel regularity, and diet quality quickly if they do it safely. Now, a safe 2-week trial, not a miracle protocol. Step 1. Choose a plant-forward plate most days. Half of the plate, vegetables and fruit. 1/4, whole grains like oats, barley, brown rice, or whole grain bread. 1/4, protein foods, beans, lentils, chickpeas, tofu, fish, eggs, or poultry, depending on your preferences and medical needs. Step 2. Reduce ultra-processed foods and processed meats. Step 3. Keep added fats modest, but do not turn food into a fear object. For some people, small amounts of unsaturated fats, nuts, seeds, or olive oil fit well in a heart-healthy pattern. The key is the overall pattern, not magic rules. Fiber matters, but seniors must increase it gradually. If you currently eat little fiber, jumping overnight to very high amounts can cause severe bloating, constipation, or diarrhea. A safer approach is to add one change every 2 to 3 days. Add a half cup of beans to lunch. Add oats or a whole grain option at breakfast. Add fruit or vegetables to one more meal. Drink fluids as your clinician allows, and walk after meals if you are able. If you develop severe abdominal pain, persistent vomiting, blood in stool, fainting, chest pain, or severe shortness of breath, stop and seek medical care. What about symbiotics, resistant starch, and butyrate? The science is promising. Certain fibers and resistant starches can increase short-chain fatty acids like butyrate in the colon, and butyrate is linked to gut barrier and immune signaling. But it is not responsible to say butyrate cures leaky gut or grows new neurons as a guaranteed outcome. In real humans, responses vary. The safest message is diverse plant fibers tend to support more favorable microbial metabolites. A practical breakfast example, simple and senior-friendly. Oats with berries, plus a protein option that fits your needs, such as yogurt, soy yogurt, or a handful of nuts if tolerated. If you like bananas, fine, ripe or slightly green. But there is no single magic banana drink. 2 more points for older adults. First, protect muscle. Older adults often need higher protein density than younger adults, especially if weight is dropping. Make sure each meal contains a meaningful protein source, and consider discussing targets with a clinician or dietitian. Second, bones. Leafy greens can contribute calcium, but absorption differs by the type of green. Spinach is not the same as kale. If osteoporosis risk is high, do not rely on slogans. Use a plan that meets calcium, vitamin D, and protein needs safely. Finally, the most medical sentence in today's video. Diet can improve risk factors, but it does not replace screening or treatment. If you are over 45, discuss colorectal cancer screening with your clinician. If you have chest pain, shortness of breath on exertion, or known heart disease, do not gamble on a 2-week reset. Get proper evaluation and evidence-based care. If you want a realistic challenge, here it is. For the next 14 days, make your default meals more plant-forward, reduce ultra-processed foods and processed meats, and increase fiber gradually, while keeping your medical conditions and medications in mind. That's not a miracle. It's a reasonable, evidence-aligned experiment. I'm Professor Oleksii Kalmykov. Thank you for watching.